40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. Right again. True is a valid answer. Healthcare facilities have grown substantially over the years. In 1950, there were only government hospitals, and in 2017, the number grew to in India. Well done. 717.23.583 is the right choice. Poor families are not provided basic necessities like drinking water, adequate housing, clean surroundings, etc., and therefore are more likely to fall ill. Smart pick. True is the correct choice. What should be changed weekly to avoid breeding of mosquitoes? Excellent choice. Water in coolers is the right answer. India is the largest producer of medicines in the world. On track. Fourth is the correct answer. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. Nicely done. True is a solid answer. Apart from disease, there are other factors that affect our health, such as dullness, inactiveness, anxiety, or being scared for long stretches of time. Sharp thinking. True is the right choice. Which one of the following is a communicable disease? You're right. Diarrhea is the correct answer. Kerala's decision made it impossible for a village to make sure that proper planning was done for water, food, women's development, and education. Right choice. False is the best answer. How many people die from tuberculosis every year? Smart move. 500,000 is an accurate answer. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to Great thinking. Panchayats is the right choice. Prevention is better than cure. You chose true, and it is correct. Which country has the largest number of medical colleges in the world and is among the largest producers of doctors? Well reasoned. India is the correct choice. Health education is also considered very important, and knowledge about health is part of education at all levels. Good thinking. An essential is the right answer. What is the full form of? Clear logic. Your choice outpatient department is sound and 100% true. A is a place where all the molasse, whether from ruling party or from the opposition, meet to discuss various things. Great job. Legislative Assembly is the accurate answer. In order to earn more money, a few private services encourage practices that are incorrect. Is this ethical? Well picked. No, not at all is the correct answer. Health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Solid response. True is a valid choice. A political party whose malas have won more than half the number of constituencies in a state can be said to be in a... Bravo! Majority is the answer. Communicable diseases are those diseases that spread from one person to another through water, food, air, etc. Correct. True is the right answer. The is the basic structural and functional unit of the public health service in the developing countries. Nice work. You chose primary healthcare centers and it is correct. Healthcare services provided by the government to uplift the health status of the population is known as. Nice selection. Public healthcare facilities is the correct and valid answer. Dash money is used by the government for funding developmental programs and services of healthcare. Good job. Your answer tax works well here. Providing healthcare facilities to the citizens is one of the most important responsibility of Dash. Perfect. Government is the correct choice. Many people die from Dash and Ash diseases only because they don't get prompt and timely treatment. Strong choice. Minor and curable is the right answer. Dash tourists Dash refers to foreigners who come to this country specifically for medical treatment. Excellent. Medical is a brilliant choice. Barely % of the population can afford all the medicine that they require during an illness. Valid point. 20 is true. At the village level, there are health centers where there is a nurse and a village health worker. You got it. Your choice true is right. Medical tourists are those foreigners who come to our country for medical treatment at hospitals. Correct response. True is the most accurate answer. According to UNICEF, more than Dash children die every year in India from preventable infections. Exactly. 1 million makes sense and it is right choice. Which out of the following is considered to one of the healthiest countries of Central America? Well reasoned. Costa Rica is the correct choice. Patients have not to pay a lot of money for every service that they use in private hospitals. Good thinking. False is the right answer. Almost half of the children in our country are Dash, as they do not get adequate food to eat. Excellent. Undernourished is a brilliant choice. Dash raises awareness about the prevention of diseases like malaria, jaundice, cholera, etc. Correct. Public health care is the right answer. Who states that providing health facility is the primary responsibility of the government? Exactly. Constitution makes sense, and it is right choice. Several years ago, Costa Rica took a very important decision and decided not to have Dash. Bravo. An army is the answer. An activity or service that is organized by an individual or company for their own profit. Great thinking. Private is the right choice. If a hospital cannot provide timely medical treatment to a person, this right is violated. Excellent choice. Right to life is the right answer. Government uses tax money for providing Dash services for the benefit of all citizens. Smart pick. Public is the correct choice. Dash of the children in India do not get adequate food to eat and are undernourished. Well picked. Wang 2 is the correct answer. Making Dash mandatory is one of the remarkable initiative of the government of you. Nicely done. Health insurance is a solid answer. At the district level, there is no hospital that supervises all the health centers. Nice work. You chose false, and it is correct.
The taxes paid by the people are used by the government for maintaining hospitals.
Correct response. True is the most accurate answer. Dash is a state responsible for individual and social well-being of its citizens. Perfect. Welfare state is the correct choice. The health services provided by the private individuals or companies is called sharp thinking. Private healthcare is the right choice. Hakim Sheikh was given proper treatment in the first hospital that he went to. You chose false, and it is correct. Capacity to remain free from physical disorder, illness, or injuries is called. Right again. Health is a valid answer. India is one of the largest producers and exporters of medicines in the world. On track. True is the correct answer. The country considered to be one of the healthiest countries in South America. Valid point. Costa Rica is true. Dash is considered to be one of the healthiest country in Central America. Smart move. Costa Rica is an accurate answer. What percentage of the state budget was given to the panchayats in Kerala? Nice selection. 40% is the correct and valid answer. The state has the responsibility to ensure that citizens are provided with. Strong choice. All of the above is the right answer. The Dash is a chain of health centers and hospitals run by the government. Good job. Your answer, public health services, works well here. In India, we face a situation where Dash are increasing but Dash are not. You got it. Your choice, private services, public services, is right. Every year number of Dash, a visit India for quality treatment at low cost. Well done. Medical tourists is the right choice. A disease that attacks large number of people in an area at a same time. Great job. Epidemic is the accurate answer. In 1996, Kerala's 40% of whole state budget was given to Dash. Solid response. Panchayats is a valid choice. What are the requirements to address the health issues in any country? Clear logic. Your choice, all of these is sound and 100% true. The system of hospitals and health centers run by government is called. You're right. Public healthcare system is the correct answer. World's largest state-funded health insurance scheme is known as Dash. Right choice. Busman Bharat scheme is the best answer. In Dash, the Kerala government made some major changes in the state. Great thinking. 1996 is the right choice. Patients usually have to wait in long queues in government hospitals. You got it. Your choice, true, is right. A large number of people fall ill to waterborne diseases because of. Excellent choice. Unclean drinking water is the right answer. What was organized by the Assembly to discuss about government work? Valid point. Press conference is true. Blood required for a patient is generally available at medicine bank. You're right. False is the correct answer. West Bengal Kat Mazdor Samiti Isam Origasashard for Dash. Perfect. Agricultural laborers is the correct choice. Most of the doctors and the nurses qualified in a large no. In dash. Bravo! India is the answer. Who is responsible for the well-being of the people in a democracy?
You chose government. And it is correct?
The areas which suffer from lack of sound healthcare facilities are. Correct. Rural is the right answer.
The number of people who die of tuberculosis in a year in India is.
Excellent. 500,000 is a brilliant choice. Dash care and sanitation are the responsibility of the state government. Great job. Healthcare is the accurate answer. What should be changed weekly to avoid the breeding of mosquitoes? Solid response. Water in coolers is a valid choice. How much percentage of all communicable diseases are waterborne? Or? Smart move. 21% is an accurate answer. Health means our ability to remain free of illness and injuries. Nice work. You chose true and it is correct. The diseases that spread from one person to another are called. Well picked. Communicable diseases is the correct answer. A foreigner who visits India for medical treatment is known as. Smart pick. Medical tourist is the correct choice. In 1950, there were only 717 government hospitals in India. Exactly. True makes sense, and it is right choice. What are the two types of healthcare services available in India? Strong choice. Public and private services is the right answer. Hakim Seth got an accident in which body part he was injured. Clear logic. Your choice head is sound and 100% true. Dash is the healthiest and happiest country in Central America. Good job. Your answer Costa Rica works well here.
India is the dash largest producer of medicines in the world.
Right again. Third is a valid answer. In India, healthcare facilities are divided into dash and dash. Good thinking. Public and private is the right answer. Hakim Sheikh was denied treatment at the government hospitals. Nice selection. True is the correct and valid answer. Patients usually have to see long queues in public hospitals. On track? True is the correct answer. Primary health services are provided dash by in rural areas. Correct response. Government is the most accurate answer. Public services are provided by the government through dash. Well reasoned. Government hospitals is the correct choice. Our ability remain free from illness and injuries is called. Sharp thinking. Heath is the right choice. For a middle-class family, medical expenses cause hardship. Nicely done. True is a solid answer. What percentage of people can afford required medical care? Right choice. 20% is the best answer. Public expenditure on healthcare today is just dash of GDP. Well done. 0.9% is the right choice. Registered medical practitioners are found in rural areas. Right again. True is a valid answer. How many people die from tuberculosis every year in India? Perfect, 500,000 is the correct choice.
Public health services are established and run by the Dash.
Well reasoned. Government is the correct choice.
Dash state government gave 40% of its budget to Panchayat.
You chose Kerala, and it is correct.
Dash is considered the healthiest nation in South America.
Bravo. Costa Rica is the answer.
Some people in rural areas travel miles and miles to Dash.
Smart move. See a doctor is an accurate answer.
In India, Dash are increasing more than public services.
Nicely done. Private services is a solid answer.
The healthcare facilities are divided into two categories.
You're right. True is the correct answer.
Is it necessary to keep our health and body fit and fine?
Correct response. Yes is the most accurate answer.
Dash number of doctors qualify every year in our country?
Nice selection. 30,000 is the correct and valid answer.
What do you mean by public health care system in India?
Right choice.
Chain of health center is the best answer.
Diseases, pollutants and bad atmosphere affect our Dash.
You got it. Your choice health is right.
Most of the doctors of India are settled in Dash areas.
Sharp thinking. Urban areas is the right choice.
India gets a large number of Dash from many countries.
Well done. Medical tourists is the right choice.
How many assembly constituencies Himachal Pradesh has?
Excellent choice. 68 is the right answer.
On which of the following does our good health depend?
Valid point. All of these is true. Which one of the following is a communicable disease? On track. Measles is the correct answer.
Disease which spread from person to another is called?
Strong choice. Communicable disease is the right answer.
Most of the tourists come to India for Dash checkup.
Good job. Your answer medical works well here.
Moral principles that influence a person's behavior.
Excellent. Ethics is a brilliant choice.
Which is one of the healthiest country in the world?
Nice work. You chose Spain, and it is correct.
What are two categories of healthcare facilities?
Well picked. Public and private is the correct answer.
How many new doctors does India produce every year?
Great thinking. 30,000 is the right choice.
Hakim Sheikh was a member of the Dash.
Exactly. Makes sense and it is right choice.
Tax money is used to fund which of the activities?
Correct. All of these is the right answer.
The two type of health services are Dash services.
Good thinking. Public and private is the right answer.
One of the healthiest countries in South America.
Solid response. Costa Rica is a valid choice.
Adequate healthcare is available to all in India.
Smart pick. False is the correct choice.
India is one among the largest producers of Dash.
Great job. Doctors is the accurate answer.
In the rural areas, one finds rumps meaning dash.
Clear logic. Your choice registered medical practitioners is sound and 100% true. India is the third largest producer of medicines. You're right. True is the correct answer. Private healthcare services provide with dash. Valid point. The best facilities is true. India is one of the biggest exporters of dash. Right again. Medicines is a valid answer.
Communicable disease are spread through dash.
Smart move. All of these is an accurate answer. Dash million people die because of malaria. Excellent. 2 million is a brilliant choice.
Health means to remain free from any kind of.
Sharp thinking. Illness is the right choice. Which type of healthcare facility is costly? Correct response. Private is the most accurate answer. By whom are the public health services run? Clear logic. Your choice government is sound and 100% true.
In which continent is Costa Rica situated?
Perfect. South America is the correct choice. Who is the head of a legislative assembly? Great thinking. Chief Minister is the right choice. Most doctors prefer to work in dash areas. Well done. Urban is the right choice. Is adequate healthcare available to all? Good thinking. No is the right answer. Who is responsible for medical services? Exactly. Health Minister makes sense and it is right choice. Dash health services are profit-oriented. Well picked. Private health service is the correct answer. Rumpy means rural medical practitioner. On track. False is the correct answer. Health is vital for people everywhere. Nice work. You chose true and it is correct. Ranjan got costly medical treatment. Nice selection. True is the correct and valid answer. Public healthcare is run by the dash. Smart pick. Government is the correct choice. Some problems still exist in Kerala. Nicely done. All the above is a solid answer.
Diarrhea is a waterborne disease.
Excellent choice. True is the right answer. In 2017, no of hospital grew. Good job, your answer 2 had thrived 583 works well here. Most doctors settle in dash areas. Strong choice. Urban is the right answer. Hakim Sheikh had accident in 1999. You chose false, and it is correct.
Costa Rica is in which continent?
Right choice. South America is the best answer. Diarrhea, worms, hepatitis, etc. Well reasoned. Waterborne diseases is the correct choice. What does the term FATEC stand for? Great job. Primary health center is the accurate answer. Who are the ramps in rural areas? Bravo. Private doctors is the answer. Hakim Sheikh was a member of dash. Solid response. Pekims is a valid choice. For medical facilities, we need correct both and is the right answer. RUMPS is the short form of DASH. You got it? Your choice, registered medical practitioners, is right. Public healthcare is expensive. Nice selection. False is the correct and valid answer. Health Minister of Tamil Nadu. Correct response. S. Vijayabhaskar is the most accurate answer. What is the full form of SDG? Right again. Sustainable Development Goal is a valid answer. By whom are the public health? Correct. Government is the right answer. Who is the full form of RUMP? Excellent. Registered medical practitioner is a brilliant choice. Health means our ability of. Perfect. Remaining free of illness is the correct choice. Wallpaper project involves. Strong choice. All of these is the right answer. Health Minister of Gujarat. Well reasoned. Mansukh Mandavia is the correct choice.
Good health depends upon.
Great thinking. All of these is the right choice. Where are medicines sold? You're right. Medical stores is the correct answer. Full form of is? Good thinking. Registered medical practitioners is the right answer. What does FATEC means? Right choice. Primary health center is the best answer. Health is a state of. You chose both 1 and 2. And it is correct. UP stands for DASH. Bravo. Outpatient department is the answer. Malaz are elected by. Smart pick. People is the correct choice. Who stands for? Solid response. World Health Organization is a valid choice. Quitsi means dash. On track. Primary Health Center is the correct answer. REMP stands for. You got it? Your choice, registered medical practitioner, is right. Health is dash. Well picked. Wealth is the correct answer. Amen had dash. Valid point. Viral fever is true. How you will get all these quiz questions in PDF books format? Excellent choice. Contact Narayan Changder on Facebook is the right answer.